From World Doc, Alan Lindemann. Doc, what's going on, man? How are you?
We're doing very well here, Neil, and you?
Fantastic. Today's topic, podcast at home HPV screen for cervical cancer. What is the human papilloma virus?
There are 200 of those, believe it or not. They're high risk and low risk, and they have the potential to cause cervical cancer. And this is a screen for HPV, which, of course, can cause cervical cancer. And I'm going to close this door because I have this echo here. Sorry.
All right, we'll go on to the next question, Doc, right when you're ready. All right.
Good.
What are the low-risk groups and what do they cause?
The low-risk groups are HPV 6 and 11, and they can cause genital warts, also warts on fingers and hands, and for babies with diapers. And so they are, and sometimes they're called cauliflower warts because they grow up like that.
What are the high-risk groups?
There are actually 15 of them, and the two biggest groups are 16 and 18, and they're found in 70% of invasive cervical cancers.
Why are some types high risk?
They can avoid or escape the body's immune system, so the body can't get rid of them.
Really interesting. Why are some types high risk?
It's because they stay in the body and they change normal cells to abnormal cells.
Are there any good screening procedures for oral virus in men since these cancers are the most common? What are you saying?
Actually, in men, oral HPV is the most common way that it presents, and it's usually in the pharynx, that's behind the mouth. And there are, unfortunately, no standard screening procedures. You have to rely on your dentist, your doctor, your oral hygienist, self-exam. If you think you have trouble, ENT would be the best. And of course, you can always get these on your voice box or larynx. And if that happens, you'll get hoarse.
Are HPV infections considered to be an STD?
Actually, some are and some aren't. How's that for an answer? You have to be careful of them. You can get them from what we call fomites, which are pillows, sheets, bedding, keyboards, telephone, doorknobs, anything that you might touch.
Are women in rural areas more likely to be diagnosed with cervical cancer?
Unfortunately, they are 25% more likely to be diagnosed with cervical cancer than urban women are, and they're 42% more likely to die from cancer than women who live in cities.
Can female patients test for HPV at home?
There is this new test, this Teal Health Wand thing that you can use. It is not yet, it has been FDA approved. It's not available yet, and you have to use a Teal Health provider to order the swab, which you can do. And unfortunately, no matter how many times you ask the question, you don't get the answer on how much they cost. The answer is, it's the United States Preventive Task Force approved, so insurance should cover it, but that is not a good answer, so we don't know how much they cost.
How does a Teal Health Wand home HPV screen cost?
We don't have the slightest idea because every time we ask, you get an evasive answer.
What if the screen indicates that you have the HPV?
Then you need to find a provider. The problem is that we don't know whether you are supposed to call Teal Health or Teal Health will call you with an answer, but you would then need to find a provider someplace.
There are two different types of HPV presentations. What are they?
The first is cutaneous or skin, that is hands, feet, arms, legs. And the second is genital.
Where are mucosal HPV types likely to be found?
Vagina, anus, cervix, vulva, foreskin, urethra of the penis, inner nose, mouth, throat, larynx, tongue, tonsils, trachea, bronchi, and the inner eyelids. And you have to be careful because babies can get this in their throats.
What are the most common HPV-related cancers in men?
They are behind the mouth, the oral pharynx, and hard to diagnose.
How big is the wand?
It is 12 inches long, and it's scary looking. Only 4 or 5 inches goes into the vagina.
All right. The best place to go is worlddocallen.com and pick up Pregnancy Your Way, available today at Amazon. Thanks, Doc.
Thank you, Neil.
All right. That was the World Doc Allen podcast, guys.